Testosterone, the king of all hormones. Aging is your reality. You are noticing the weight gain, hair loss, muscle fading, fatigue, slower sex drive, and you are grumpy. True, you are getting older, but low testosterone could be the culprit. I'm a man, you say to yourself. I want to enjoy being a man without harming myself. I want to look and feel great. Have the kind of energy and stamina that gives me confidence. The wheels in your head are turning. Is this what I have to look forward to as I get older?
Men and women have testosterone. Men have much more normally, and it is the hormone that really provides the characteristics that distinguishes men from women. Now, with respect to testosterone and aging, there's a condition you've heard of with respect to women with aging called menopause, where they have a decrease in estrogen production. In men, it's called andropause, and it is a decline in testosterone concentration. Now, just simple aging alone is enough to cause a significant decrease in the amount of testosterone over time. Unfortunately, our present environment and the conditions that we're exposed to accelerate that process. That's very important to know. So you can be much younger and have a profile that appears to be like someone much older. And here's why. The stresses of life, the chemicals in our environment, there are foods and substances that are called endocrine disruptors, and so they change how our glands function and put them into a state of dysfunction and dysregulation. So there are a lot of things that are working against men and women with respect to their hormone status, and we're talking about testosterone now. The types of things that occur in men who have low testosterone levels, and the ranges are, they vary in terms of where people should be for their particular need. But in general, a decrease in focus, memory, stamina, motivation, libido, recovery from exercise, strength, things of that sort. Insomnia is another part, depression. These are all things that can be associated with low hormones and testosterone in particular. And consistent with this is often misdiagnoses. Someone being described as fundamentally depressed and given medications for that, when in fact, theirs is more of a hormonally induced problem, or the imbalance of their hormones causing these problems. If missed, then these medications can do more harm than good. Certainly is not going to benefit the person as much as it is hoped to. So investigating this kind of a situation is part of what we do, and it's really something that needs to be done. Basically, when it comes to who we are and all of the factors that go into health, and health is more than just the absence of disease. It's actually the presence of optimism, energy, positivity, and all of these things. So not just being without an actual disease, but in possession of what makes us most human. And that's, a part of, an essential part of what we do with our program. So that's the story on testosterone. Our replacement for testosterone problems, as is the case with all hormones, is a bioidentical version, so that the compatibility with our particular natures as humans is guaranteed and safe. So that's testosterone.
Spectrum HRT is acutely aware of how important the role of testosterone plays in your body. Andropause, a male condition or phase resulting from dwindling levels of testosterone, is largely responsible for symptoms such as, but not limited to, irritability, lack of bone strength, hypertension, poor cholesterol levels, hot flashes, heart disease, depression, high blood sugar, increased weight in abdomen area, loss of body mass, loss of hair, memory loss, diminished sex drive, increased chance of certain types of cancer such as prostate cancer. On the other hand, too much testosterone can cause insomnia, low sperm count, acne, male pattern baldness, liver disease, heart muscle damage, cardiovascular problems, gynecomastia, enlarged breast, aggressive behavior, impotence, heart muscle damage. Your Spectrum HRT physician will inform you if you have too much testosterone and will direct what the best treatment plan should be. Do not take it upon yourself to obtain and take this hormone without the supervision of a qualified physician. Take advantage of your choice to participate in life by taking it to new and exciting levels, the way you want it again. Contact a Spectrum HRT consultant today on 1-866-306-8139.